Hi, good evening, all, and welcome back to this series on professional exams made easy, targeting the first MBBS exam. And here we are with our fourth episode, where we will discuss about the most frequently asked topics from upper limb, and also we'll discuss about some of the commonly asked questions. Welcome back to this. Some of the commonly asked topics and how to approach if these topics are asked in exams, right? So let's get started with what are the most frequently asked topics from the section of the upper limb. Again, we'll try to arrange it systematically, starting from the first chapter to the last chapter. And as we did with the last discussion, we'll start with the topic of the bones of the upper limb. Now, in the topic of bones of the upper limb, the questions are very often asked as 3-marker questions, or we get a lot of MCQs, right? Very rarely we get 5-marker questions from this chapter, but there are very important 3-marker questions or MCQs which are like very easy to score, right? And there are again limited topics that we need to learn for exam, right? For theory exam. Now, you can expect like a 3-marker question on peculiarities of the clavicle. So why clavicle is called as modified long bone, and then what are the features of clavicle, and then one more question that you can get on clavicle is what is the anatomical basis for, right? What is the anatomical basis for the fracture of the clavicle, right? Why does fracture of the clavicle occurs at the junction of the medial 2/3 and the lateral 1/3, or the medial 3/5 and the lateral 2/5? Okay, the anatomical basis for the fracture of clavicle, what is the commonest site and where exactly the fracture occurs and what is the most common cause, right? Now, the next important question is the coracoid process of the scapula. The coracoid process of scapula is very frequently asked because, as we have learned, the coracoid process is an example for what type of epiphysis. So when we talk about the types of epiphysis, we know that this belongs to the atavistic epiphysis, right? So this is often, hi Karthik, good evening. So this is often asked as the uh, atavistic epiphysis is often asked as a 3-marker question. Why it is atavistic epiphysis? Why is it called so? And then the other thing that is commonly asked about the coracoid process is the muscles which are attached here. Okay, the muscles attached to coracoid process. Done. So these are very often asked 3-marker questions. Hi Abdul, welcome. So this is regarding the second important short answer. Okay. Then when we talk about humerus, in humerus, we have 3 important questions. One is question related to the necks of the humerus. What are the different types of neck of the humerus? For example, what do we mean by the anatomical neck? What do we mean by morphological neck? And what do we mean by the surgical neck? Okay. So these could be 3-marker questions again. So this is a 3-marker, then this is a definite 3-marker, right? Then what are the nerves related to humerus? So here, remember, what are the nerves related, right? For example, where is the axillary nerve related? Where is the radial nerve related? And where is the ulnar nerve related to the humerus, right? Yes, thank you. Thank you, Abdul. We'll continue making a good content and valuable content for your exams, right? So, nerves related to humerus, remember, there are 3. One is the axillary nerve, right? Then the next one is the radial nerve, and then the next one is the ulnar nerve. Where exactly these are related? For example, axillary nerve is related to the surgical neck, right? Radial nerve is related to the spiral groove, and ulnar nerve is related to the posterior surface of the medial epicondyle, right? So nerve as well as where exactly it is related. This could form the basis for the clinical case in long essays, right? They can start with a fracture of the bone clinical case scenario, and they can ask you about what is the possible nerve involved. So it is not just asked as a 3-marker, a long essay can actually begin with fracture of any of these sites and what possible nerve is injured, and then they can ask you about the anatomy of that particular nerve in detail. Right? Done. The next thing is regarding bicipital groove, or otherwise called as the intertubercular sulcus. So what is bicipital groove? Now, what are the structures attached to the bicipital groove, right? And then what about the contents which are present in the floor of the bicipital groove? Okay, these are the possible questions that we might get. Done? Are we clear? So in the bones, we often expect questions from these topics, right? This is for your theory exam. Of course, for your practical exam, you must know the site determination, important parts of the bone, important muscle attachments, and nerves related. This is what we need to know for practical. But for theory exams, these are the topics from which we can expect questions from the chapter of bones, right? Now, apart from this, hi Tinu, good evening, welcome. So the next topic is the pectoral region. Okay. The most often asked question in this pectoral region is the clavipectoral fascia. Okay. Often asked as a 5-marker question or 3-marker question. What is clavipectoral fascia? Right. So if asked, what is clavipectoral fascia? Then what is the extent of the clavipectoral fascia? What about its attachments? What about the structures piercing? Right? So these are the possible questions, right? Thank you, Rahul. Welcome. So, hi. Hi. Thank you. Hi, Brewster. Thank you. Welcome. So, definition, extension, attachments, and then structures piercing. The structures piercing clavipectoral fascia is often asked as an MCQ question, right? So this is regarding clavipectoral fascia. In this chapter, this is one question that is very frequently asked, a very frequently asked, a favorite topic of examiners or paper setters. Okay. Then when it comes to muscles of the pectoral region, there is a great chance that they will ask about pectoralis minor rather than pectoralis major. We have seen questions on pectoralis major, but if you compare the frequency, question on pectoralis minor is more. Why? Because pectoralis minor is the key muscle of the pectoral region, which helps to divide the axillary artery into 3 parts and also helps in staging of the axillary lymph nodes. Fine. So that's why this topic is very frequently asked. Okay. Hi. Hi, Venkatesh. Right. So this is one more important topic you need to know. Pectoralis minor could be asked as a reasoning question. Okay. This could be a reasoning question. Now, the reasoning question, pectoralis minor muscle is called as the key muscle of the pectoral region. Justify. Okay. Or is this statement true? Justify. This is how reasoning questions will be made. Okay. Of course, pectoralis major, right? Then there can be questions on serratus anterior. So all these questions, remember, are potential 5-marker questions. Okay. Serratus anterior mainly asked with a clinical background of the winging of scapula, right? Again, this could be a case-based question, right? If they ask about the serratus anterior, it could be a case-based question, right? Attachments, innervation actions, and then the clinical anatomy. What is winging of scapula? What is the anatomical basis for winging of scapula? Now, this is also a perfect material for a reasoning type of question. Done. Then, of course, the mammary gland. Now, how we can ignore this topic, right? So, mammary gland is a potential 10-marker or a 15-marker question, right? It is a very important long essay in the entire section of upper limb. Then, in the mammary gland topic itself, right? The blood supply of the mammary gland, then the lymphatic drainage, right? The lymphatic drainage, and then development. Now, these are sub questions out of which we have seen a lot of questions on the lymphatic drainage. Okay. Now, this is asked as a very important 5-marker. Blood supply, remember, including arterial supply as well as the venous drainage, is an important 5-marker. And development is usually asked as a 3-marker. Okay. anatomical basis behind athelia, polythelia, right? All this could be important 3-marker reasoning questions. Okay. In the entire upper limb, mammary gland is one question which can be asked like in every exam, right? This is like favorite of every paper setters. Like why this is asked as a very commonly asked long essay. Remember, breast carcinoma is among the second most common cancer that kills women across the world as well as in India, right? So anatomy of the breast, especially its lymphatic drainage, is a must know. You can never skip this topic, right? Done. Yep. Hi, Amanth. Hi, Aryan. Welcome to the session. Right now, this is regarding the pectoral region. Now, once we have learned about the pectoral region, let's talk about the axilla. Right? Similar to the pectoral region, in case of axilla, like let's say the most important topic for your long essay is the brachial plexus. Okay, so this could be a 10 marker or a 15 marker question. Axillary artery could be a 10 marker or a 5 marker question again. Erb's palsy and Klumpke's palsy, very important, right? Important 5 markers or 3 marker question. And scapular anastomosis, again an important 5 marker question. What we will do today is we will try to learn also, once we finish with the frequently asked topics, if axillary artery is asked or any other artery in the upper limb is asked, how we should approach structuring the answer. So end of the session, we will focus on how do we structure the answer if an artery is asked? How do we structure the answer if a nerve is asked in the exam? Fine. This is what we'll try to do once we see the most frequently asked topics. So in the chapter of axilla, brachial plexus, long essay, Erb's palsy and Klumpke's palsy, the anatomical basis behind the clinical features are very important 5 marker questions. Done? Right. Then back of the scapula or back of the body and the scapular region. Okay, this is one topic which we often tend to skip, but there are a lot of important questions from this chapter. Okay, so we have seen questions on trapezius and latissimus dorsi which have been asked as 5 marker questions. Okay, you take any major universities in the country, these are the 2 muscles from the back which have been very frequently asked, right? Then this triangle of auscultation and lumbar triangle. Okay, now these are important 3 marker questions, right? Then in the scapulohumeral muscles, right? The question can be asked as scapulohumeral muscles, but very often this scapulohumeral muscles question is based on the following muscles. One is the deltoid muscle. Okay, attachments of the deltoid, nerve supply of the deltoid, actions, structures under the cover of deltoid, right? Then the sit muscles, right? The supraspinatus, infraspinatus, and teres minor muscle. This is again a favorite topic of your paper setters, right? So these are the muscles in the scapulohumeral region that you must be thorough with, right? The deltoid muscle, right? This is a very important 5 marker again, right? So these are often asked as 5 marker questions. We have not seen long essay, but 5 marker questions. Then comes one of the most important topic in this region, that is the rotator cuff. Again, a very important 5 marker question. Done? What is rotator cuff, right? So how do we explain? So define what is rotator cuff, describe the formation of the rotator cuff, then talk about function of the rotator cuff. What is the function of the rotator cuff? And then talk about its clinical anatomy. What happens if rotator cuff is damaged? For example, rotator cuff supports the head of the humerus from above, right? If you see your Vishram Singh textbook, a wonderful diagram is given, right? Where the 4 muscles hold the top of the humerus and prevent the superior dislocation or the upper dislocation. This is what we need to describe in function. And what happens if the rotator cuff is injured, right? This is what we need to describe in rotator cuff. Again, very commonly asked 5 marker question. If there is a change of question paper, as we are expecting with most of the universities, and there will be a lot of clinical anatomy based question from the upper limb, Erb's palsy, rotator cuff, these are like, again, very favorite topics of your paper setters, fine? So go through this. Done? Yeah. Thank you. Thank you, Jaitan. Thank you, Ashok. Thank you, S. Right? So what we will do after discussing about this, right? Rotate our cuff. The next important topic we have is the movements of the scapula. Okay. So this is also an important short note, or let's say a 5 marker. What are the movements that occur at the shoulder joint, and what muscles bring about these movements? So what are the movements that scapula is capable of, and what muscles can bring about these movements is a very important 5 marker again, right? Then the spaces around the scapula, where we have the quadrangular space, right? So we have the quadrangular space, and then what do we have? We have the triangular space, right? And in triangular space, we have the upper and lower. All three could be asked as like a 5 marker question again. Individual spaces could be important, 3 markers, or MCQ questions. Fine. So we need to know thoroughly what are the boundaries and what are the contents of the quadrangular, triangular spaces. Right. So this is one topic, right? Very often we tend to skip this, but my suggestion, this is one topic that we need to be prepared for every exam again. What are the movements occurring at the scapula, and what muscles bring about these movements, right? Done. Then in the arm, possibly the easiest chapter in the entire upper limb, we need to learn about two important muscles in the anterior compartment, right? And one important muscle in the posterior compartment, right? The biceps brachii, coracobrachialis, and triceps brachii, right? Again, the same thing. Attachments, innervation, and actions. Done? Right. Then in this, these are asked as, let's say, 5 marker questions. Okay. So all these muscles are basically asked as 5 marker questions, whereas muscular cutaneous nerve is one more important 5 marker, right? Then radial nerve in spiral groove, this is a very important 10 marker or a 5 marker, right? In the entire upper limb, long essays can be asked from the chapter of or from the nerves. Radial, most common. After radial nerve, median, the second most commonly asked nerve. Then the third is ulnar nerve. And then the fourth would be the axillary nerve, right? In this order, right? Thank you, Shrest. Welcome. Done. So this is regarding the 4 important nerves that are very often asked. End of the session, we will talk about how to distinguish each of these nerves, how to explain these nerves in detail, right? Now, the next important question is on the brachial artery and the profunda brachii artery. Okay. Again, both of these are like 5 marker questions. End of the session, as I said, we will discuss about how to approach answering to an artery, how to approach answering if a nerve is asked, right? Then in forearm, cubital fossa, a very important 5 marker, boundaries and contents and clinical anatomy. Anastomosis around elbow, an important 5 marker or a 3 marker. Palmaris longus could be an important 3 marker. Hi Aditya, welcome. Right? Then the flexor digitorum profundus. We don't often see a lot of questions on the muscles of the anterior compartment of the forearm, but flexor digitorum profundus is one muscle which could be asked. Then the supinata muscle, right? Supinata muscle. Then in the entire chapter of anterior and posterior compartment of the forearm, if I were given a chance to set a question, the topic would be on anterior or posterior interosseous nerve. Even in this, the posterior interosseous nerve is more frequently asked than anterior interosseous. A branch of the median nerve, anterior interosseous, supplying the deep muscles of the front of the forearm. Posterior interosseous nerve supplying most of the muscles of back of the forearm, right? Ending in a pseudoganglion, right? So anterior and posterior interosseous nerve are asked much more frequently than any other subtopic in the chapter of forearm. Forearm is very important for your practicals. Both anterior compartment and posterior compartment are very frequently kept discussion topics or auspiciations, right? Whereas these nerves are very often asked in theory question, right? Done. Then the next important topic or chapter is the chapter of hand, right? In chapter of hand, one question without which you cannot go to your exam is the intrinsic muscles of the hand, right? This is very important question, right? So this is very important for a 10 marker or a 15 marker question. Now here we need to discuss about all the 20 intrinsic muscles of the hand, starting with your thenar muscles, hypothenar muscles, lumbricals, palmar, and dorsal interossei, right? Each of these muscles, right? Each group, for example, thenar, hypothenar, palmar interossei, dorsal interossei, lumbricals, each of these could be further subdivided as 5 marker questions. Done. So this is one important topic that you need to be prepared in the chapter of the hand. Then the flexor and extensor retinaculum of hand. What is frequently asked here? So remember, they ask about definition, they ask about attachments, right? They ask about attachments, and then they ask about the structures related, right? For example, in case of flexor retinaculum, what are the structures passing superficial to it? What are the structures passing deep to it? What is the anatomical basis behind the carpal tunnel syndrome? The carpal tunnel syndrome could be an important case-based question for a long essay on the median nerve. Okay, so carpal tunnel syndrome could be an important case-based question for the long essay on median nerve, right? In fact, we have seen carpal tunnel syndrome case being given as the long essay question to ask about median nerve. Then, in the same chapter of hand, we need to be prepared for the superficial palmar arch and the deep palmar arch, right? Both are important 5 marker questions similar to the flexor and extensor retinaculum, right? Hi Vinith, hi Gauss, welcome, welcome. Thank you. So superficial and deep palmar arches are very important 5 marker questions, okay? Then ulnar nerve and median nerve in the hand. These are again very important 10 marker, or let's say in some of the universities, this could be the 15 marker question, right? Remember, this is only about the course in the hand. It is not about the entire nerve that we are talking about. Ulnar nerve and median nerve as such are like long essay questions, but their course distribution in the hand itself could be a 10 marker or a long essay, right? Then we can also expect questions on the dorsal digital expansion would be a 5 marker or a 3 marker. Spaces of hand, if the examiner wants to make it like really tough, this could come as a 10 marker, but more often this is like a 5 marker question. It will come as 5 marker question, more frequently as a 10 marker. Okay. If it is asked as 10 marker, then we need to classify the spaces of the hand and then discuss about each of the spaces in detail, right? Otherwise, usually when they ask about spaces of the hand, they specifically ask about the mid palmar space or like, let's say the thenar space. Done. This is regarding the chapter of the hand, right? Now, apart from this, the joints of the upper limb. Remember, shoulder joint, elbow joint. Both of these are long essays, right? 10 markers or let's say 15 marker questions. So is your wrist joint. I still remember one of the instances in which wrist joint was asked as a 10 marker question in RGHS, if I'm correct. So very rarely we expect question on wrist joint as a long essay, right? But this has been asked, right? And as I keep saying, if we miss a topic which has been previously asked, then it's a crime, right? So please be prepared for the shoulder joint, elbow joint, and wrist joint for like long essays. The rest of the joints, for example, radial joint is an important 5 marker. Pronation and supination is an important 5 marker or a 3 marker. The first carpometacarpal joint is an example for 5 marker question. Done. Now, pronation, supination. In lower limb, the inversion and eversion. These are two questions again, which are like very oftenly asked as either 3 markers or 5 marker questions. Okay. So in the joints, these are the topics that we need to be thoroughly prepared for. Done. As I said, we have seen long essays from the topic of shoulder joint, elbow joint, and wrist joint. Fine. So don't neglect these joints. And if a joint has been asked in the previous exam, don't think that like this exam it will not come, right? Even examiners are like smart. They'll also be looking at previous year question papers. They will also be thinking like just like students. Okay. Possibly they would also guess, okay, if this question has come in this exam, the student might skip it for the upcoming exam and they might ask it again. So never skip a question which has been asked in the previous year exams. Let it be the immediate preceding year or 2 years, 3 years back, right? Then the last, and we have 2 more chapters, of course. One is the nerves of the upper limb, and the other one is regarding the cutaneous innervation. In the nerves of the upper limb, again, radial nerve, median nerve, ulnar nerve. All these are like 10 marker questions. Okay, long essays. Starting from their formation, course, branches, area of distribution, clinical anatomy, uh, everything, right? Under 10 mark. Then axillary nerve could be an important 5 marker. Muscular cutaneous nerve could be an important 5 marker. In addition to this, as we have learned, the median nerve and the ulnar nerve in the hand, these also could be important 10 marker questions, right? So these have been already asked as like 10 markers. So please be prepared for these 3 nerves for long essay or 10 mark. In the chapter of cutaneous innervation and lymphatic drainage, we can expect like a 5 marker question or a 3 marker question on the cutaneous innervation of the hand, especially the diagrammatic representation of the cutaneous innervation of, let's say, the dorsum of the hand or the palm, right? Then question could be asked on the cephalic vein. Then question could be asked on the median cubital vein, axillary lymph nodes. Median cubital vein is again an important 3 marker question, right? And this could also be an important topic for the reasoning type of question, where they can ask why median cubital vein is often preferred for venesection. What is the anatomical basis, right? This could be the question. Axillary lymph nodes, if they ask, right, we can talk about the groups, right? Then we can talk about the location. What about the afferent vessels? What about the efferent vessels? And what about the clinical anatomy, right? So any lymph node we can describe like this. Done. So these are like the most important topics which we need to be prepared in the section of the upper limb. Hi Ravi. Hi Sushmita. Hi. Good evening. So what we have done in the first half is we have tried to discuss about what are the most frequently asked topics in upper limb, right? In the next half of the session, let's focus quickly on, let's imagine an artery is asked as a 10 marker or a nerve is asked as a 10 marker, how we should approach answering these topics, right? For example, first, let's talk about if the question is on the anatomy of the arteries, right? How do we approach this question on arteries? So let's imagine the question is on describe the axillary artery in detail. Fine, that's one simple question. So imagine the question is on the anatomy of the axillary artery. Now, how would I describe this? Done. So first, maybe a line of introduction, right? The axillary artery is the artery of the axilla. Remember, when we talk about artery of the upper limb, we usually describe the subclavian artery as the chief artery of the upper limb, right? So introduction, one line. Axillary artery is the chief artery of the axilla, right? Then, how does axillary artery originate, right? What do we write in this? Axillary artery originates as what? The continuation of the third part of subclavian artery, right? So it continues as the third part of the subclavian artery. And how does the artery terminate, right? So one line of introduction, then origin, and then introduction. Oh, sorry, termination, right? Now in termination, what we will write? Remember, it terminates by continuing as, right? Continuing as what? Brachial artery, right? So if one mark has been set, let's say for origin termination, you already have your marks in the back. This is applicable to any artery that we learn in the body. How does it originate? How does it terminate? Then from where to where does it extend? Right? So this is from, let's say, the outer border of first rib, right? Outer border of first rib to lower border of teres major muscle, right? So for this, we can draw a diagram, right? This could be the course of the axillary artery, right? So we can simply show the outline of the first rib, right? So this could be the outline of the first rib, right? And here we can simply show the lower border of the teres major muscle, right? So this could be teres major, this could be the first rib. Even diagrammatic representation, a simple line diagram like this should be enough, right? Now, what is the next thing that we would write once we have written extent? Is it divided into parts? Yes, of course, it is divided into parts. By what? It is divided into how many parts? It is divided into three parts, right? Three parts by what? The pectoralis minor muscle. Now, if you have time, you can draw a separate diagram for this, or otherwise, my suggestion, just show the outline of the pectoralis major dividing the artery into first part, second part, and the third part. Done. So diagrammatically, you have shown how the muscle is dividing the artery into three parts, right? The only suggestion I would have here is probably write the key, okay, the direction. For example, let's say we have the medial, lateral, superior, inferior, like this. Done. This is a must for any diagram that you write. So talk about parts, right? Then what we will write? We will talk about course and relations, right? So we need to mention the course and relation for the three parts of the axillary artery. Right. Now, this is seen as like a difficult question by most of the students. For example, now if I want to reach the axillary artery, right? If I want to reach the axillary artery, what are the structures that I need to remove? Starting from skin, superficial fascia, pectoralis major, minor, everything, right? Think of relations like this and try to remember. For example, imagine we have the axillary artery second part. So let's imagine this is the relation of the second part of the axillary artery, and I am mentioning the superficial relations. Okay. The superficial relation, most important relation I should mention is the pectoralis minor. Covering the top of pectoralis minor, we have the pectoralis major. So if I draw the key, this is superficial, this is deep, let's say this is like medial, this is lateral. Done. So this is how we need to describe the relations. And remember, when we talk about the relations of the axillary artery, the most important relation the examiner would expect you to write is the relations of brachial plexus. And we know that the chords of the brachial plexus are related to the second part of the axillary artery. For example, if we call the chord of a brachial plexus as lateral chord, it is present lateral to the second part of axillary artery. So what I'll do, I'll write the lateral chord on the lateral side, medial chord on the medial side, and posterior chord posterior. Done. Right? These are the major relations that the examiner is looking for. Right? And you need to catch this. The diagram in Vishram Singh and Chaurasia, it's like very difficult to understand to begin with. But once you understand the direction in which the diagram has been depicted, it becomes a lot easier, right? This is what we need to describe in course and relations. Done? Then what we will do, we will talk about next regarding the branches, right? Branches and area of distribution, right? Now what we will write in branches and area of distribution, right? Yes. Good evening, Sai. We will definitely try Sai. Okay. Hi, everyone. So branches and distribution of the axillary artery. So what we will write here now, remember, we can write it as a table here. Branches, then area of distribution, right? So we can make a table out of it. So start naming. For example, first part gives off only one branch, second part two branches, third part three branches. First part gives rise to superior thoracic artery. Now, what is the area supplied by superior thoracic artery? It supplies the anterior thoracic wall. It also supplies the mammary gland. Similar to this, all we need to remember here is name of the artery, the area it supplies. Okay, don't go too much in depth trying to learn the relation of each of the branches. Not required. Okay, name of the artery, where does it supply? And end your answer with the clinical anatomy. Right. Now, 1, 2, 3, 4, 5, 6, 7, 8. If they have not given the subdivisions of a long essay, this is how you should describe or approach the answer for a question on any artery in the body. Of course, we know not all arteries are divided into parts. Wherever it is applicable, talk about parts. For example, subclavian artery. For example, vertebral artery, right? Middle cerebral artery. So wherever parts are applicable, write about the parts. If it is not there, leave it off, right? But this is how you should explain, and this is how you should pick the information from your textbook, right? This is all that is needed. Done? Imagine you have written the entire axillary artery under these 8 headings. Where would the examiner cut the marks, right? So when you prepare for your exam, the ultimate goal should be, if this topic comes in the exam, how I would answer this question. Okay, if they have not given headings, how I would describe in those headings, how I would represent the content, right? This is what we need to know, right? Done. So this is regarding the axillary artery, right? Done. Now, similarly, okay, Sai was asking about injuries of the upper limb, right? Now, we may not be able to cover all the injuries of the upper limb, but since like we have talked about an artery, how to represent the answer, let's see if a question is on how to approach the question on nerves, how I would describe it. Okay, so let's try to understand. Fine. So this is on the approach to questions on nerves. Now here we are focusing on the upper limb, right? Upper limb, lower limb, it is the same. Remember, for cranial nerves, it is slightly different, and we have discussed it during the topic of the head and neck and neuroanatomy, right? Now, how do we approach any question on nerves? Let's imagine the question is on the anatomy of the median nerve, right? Now, how I would describe the question on or answer the question on median nerve. Now, again, the focus should be on structuring the answer again. The median nerve, let's say we'll start with little bit of introduction. Median nerve is also called as the laborer's nerve, right? It forms the chief nerve supply of front of the muscles of the forearm, right? Muscles of front of the forearm. This could be one line of introduction. Start any answer with a line of introduction about that particular structure. Okay, then the next thing would be about the nerve. We are talking about, like, let's say formation, or let's even call it as origin. Now, in case of median nerve, it is very peculiar, right? The median nerve arises by two roots. What are the roots? It arises by a medial root and a lateral root, right? The medial root is a branch of medial cord of the brachial plexus. Lateral root is a branch of the lateral cord of brachial plexus. So this we need to mention in the origin. For the nerves of the upper limb and nerves of the lower limb, one more important thing that we need to quote is the root value, right? So this is applicable mainly for the nerves of the upper limb and the lower limb. For example, when we talk about median nerve, we know that median nerve is formed by C5, C6, C7, C8 and T1. All the 5 nerve roots. There are 2 nerves in the entire brachial plexus which will have all the root values. One is median nerve and the other one is radial nerve. Right? Then the next important thing is, once we have described about the formation and the root value, we talk about the course and relations. Right? Now, for the nerves of the upper limb, how we would describe the course and relation? Remember, you need to describe it under the headings of in the axilla, right? Then in the arm, then in the forearm, and finally in the hand. Okay, this is exactly how you should describe the answer, right? Imagine if you have written like this, the examiners will find it very easy to evaluate, right? So this is how we should write it. Okay, now let's try to draw a simple line diagram to discuss the entire course and relations of the median nerve, right? So median nerve, as we just learned, is formed by the union of what? So we have C5, then C6, C7, C8 and T1 nerve roots, right? The C5, then C6 and C7. These nerve roots will unite to form what trunk or what root of the brachial plexus, what root of the median nerve? This will form the lateral root. Similarly, C8 and T1. These will unite to form one more root. And what is this root? This is the medial root, and this descends as the median nerve. So remember all of this, the formation of the medial root, right? And then the median nerve, this occurs where? This occurs in the axilla, right? Then what about the next part? The next part we have as the arm, and the next part we have as the forearm, and the last part we have as the hand, right? So in the axilla, what are the important relations you are mentioning? Remember, the median nerve arises as lateral root and medial root, which will unite in the front of third part of the axillary artery to form the trunk of the median nerve. Right? Done. This is what we need to mention in axilla. Then, what about the arm? What is that important thing we need to discuss in the arm? Remember, in the arm, the median nerve crosses the brachial artery. So let's imagine this is the brachial artery. Initially, the nerve is lateral to the brachial artery. At the level of insertion of coracobrachialis, it passes anterior to the artery and then it descends on the medial side of the artery. This is how we can show. That's it. Okay. What happens in the arm? Remember, before it passes to the forearm, right? It gives a branch, right? Now, this is branch to pronator teres, right? So, this is a branch given off to the pronator teres muscle. Done? Are we clear? Now, how does the median nerve enters the forearm? Remember here, as it enters the forearm, remember it lies in the cubital fossa. In the cubital fossa, what is the arrangement of structures we need to remember? So we have the median nerve, then we have what? The tendon of the biceps, the brachial artery, right? And then the radial nerve. right? So this is how we need to describe the structures in the cubital fossa. Done? Right. Then what we will write? Remember, the nerve, as it enters the forearm, it passes between the two heads of the pronator teres. So we can show the two heads, and we can show that the nerve is passing between the two heads of the pronator teres muscle. This is how the nerve will enter the forearm. Now here in the forearm, what happens is the muscle will supply rest of the superficial muscles of the front of the forearm. Okay, we will talk about the branches a little bit later, but let's finish the course. Then as it comes to the hand, we have an important structure here, and what is it? We have the flexor retinaculum, right? And the nerve passes deep to flexor retinaculum, comes out, divides into a recurrent branch, and then it divides into a lateral division and a medial division. This is how the nerve will terminate. Okay, so this is called as the recurrent branch. This is like the lateral division, and this is the medial division. This is regarding the entire course of the median nerve, which is depicted in one single diagram, right? This is how you can describe the course and relations. But remember, describing it under these headings is a must. You have to. Done? Then the next important thing you would write, let's say, is talk about branches and area of distribution. Again, use the same headings in axilla, in arm, in forearm, and then in hand. Remember, median nerve will not give any branch in the axilla. Done. That's all you need to write. In the arm, median nerve will not supply any muscle in the arm, but it does give the branch to pronator teres before it enters into the forearm. Done. This is what we need to write for the branches of the median nerve in the arm. It does not supply any muscle. Totally agree. The biceps brachii, coracobrachialis, brachialis, all are supplied by musculocutaneous nerve. But the branch to the pronator teres arises here in the arm. Then, what about in the forearm? Remember, in the forearm, it supplies palmaris longus muscle. Then, it supplies the flexor carpi radialis muscle. It supplies the flexor digitorum superficialis muscle. Four muscles. Flexor carpi ulnaris is innervated by ulnar nerve. Apart from this, what happens? It gives off the anterior interosseous nerve. Now, what is the function of anterior interosseous nerve? This supplies the flexor pollicis longus, then the medial half of flexor digitorum profundus. So the medial half of flexor digitorum, not the medial half, sorry, medial half is by the ulnar nerve. So this supplies the lateral half. Then it also supplies one more muscle, that is pronator quadratus. Done? No cutaneous branches. Then once it comes to the flexor retinaculum, here it gives off a palmar cutaneous branch, which passes superficial to flexor retinaculum. It's a cutaneous nerve. The trunk passes deep to what? The flexor retinaculum lying within the carpal tunnel. Once it reaches the distal border of the flexor retinaculum, it splits or it gives rise to the recurrent branch, and this recurrent branch will supply all the thenar muscles. Now, what are the thenar muscles? The flexor pollicis brevis, then abductor pollicis brevis, opponens pollicis. So all these three thenar muscles are supplied by recurrent branch, and what happens later? It divides into lateral division and medial division. What is the fate of lateral division? The lateral division will give rise to three proper digital nerves. So proper digital nerves given off to what fingers? The lateral side of the thumb, medial side of the thumb, and lateral side of the index finger. Then what is the fate of the medial division? The medial division will split into two branches, common digital nerves, and these further split into the proper digital nerves. Right? This is how the median nerve divides in the hand. The most medial branch will supply the first and the second lumbrical, whereas what will happen to the common digital branches? The common digital branches, as they reach the web space, they divide into the proper digital nerves for the index finger and the middle finger, and then they supply the side of the middle finger and the ring finger. So in total, the median nerve will supply the 3.5 digits skin of 3.5 digits of the hand, skin of the hand, right? This is how we can describe the course and relation. And remember, one simple diagram is enough. But if you have time, my suggestion, write the impression of your own hand and then talk about the distribution of the median nerve in the hand beautifully, right? So two diagrams I would suggest. One simple diagram to explain the course in a line diagram. The second diagram, if you have time, the outline of the hand, use it drawing your own hand. Okay. Use your hand as an impression and draw that hand and then show the branches of the median nerve, right? Nothing like it. Once you have done this, probably end your answer with clinical anatomy. And in clinical anatomy, never forget to mention about the carpal tunnel syndrome. Now, what is carpal tunnel syndrome? What is the anatomical basis behind the carpal tunnel syndrome? What are the clinical features? What about the anatomical basis for each of the clinical features? Right? This is what we need to write for the carpal tunnel syndrome and its anatomical basis. Are we clear? Right? This is how you should approach the question on median now. Done? This is just a template. Okay. Introduction, formation, root value, course and relation, branches and distribution, and finally clinical anatomy. Fine. Even if an examiner subdivides your question, these are the headings they would give. So for any nerve of the upper limb, lower limb, please prepare yourself under these headings so that you will describe the answers under these headings. Done? This is just an example. Okay. Even for like radial nerve, ulnar nerve, axillary nerve, muscular cutaneous nerve, sciatic nerve in the lower limb, or common peroneal nerve, tibial nerve, any nerve, try and learn like this and try and present your answer like this. And let's see why don't you score marks. Done? So this is what I wanted to discuss and I wanted to give an overview on, right? Of course, in the limited time that we have every week, we will not be able to cover all the topics, but my focus is on making you learn how to present an answer and how to approach an answer. Once you learn it, you can learn any topic. And this is applicable to any topic that you will learn further in the upper limb. Fine. If you have any doubts related to whatever we have discussed since like last 50 minutes, please feel free to ask anything before we close. And thank you very much for staying through and giving your comments throughout the session. If you have any questions related to whatever we have discussed today, please feel free to ask. Thank you, Josefa. Fine. So since we have no questions, again, this is the schedule that we are following. we are already done with the topics of the head and neck. We are done with the topics of neuro, thorax, and upper limb. And we would be covering the lower limb in the next week session. Okay, that is on 7th July. And starting from 14th July, we will have sessions on abdomen, pelvis, histology, embryology, and general anatomy, right? Looking forward to meet you there again next week for the session on lower limb, right? Thanks once again for joining this session. All the best for your third internals. I know that it's like coming up. All the best for your third internals as well as your university exam. Let's meet up next week for the session on lower limb.